Hello everyone, my name is Jai Luji. Today I'll be giving you a short presentation on does low-level laser therapy enhance the efficiency of orthodontic dental alignment. To begin with, I'd like to talk to you on why it's important to enhance the efficiency of orthodontic treatment. The reason is that it's not just to satisfy your patient's desire, but also reduce the associated risk of caries, gingival inflammation, alveolar bone loss, and root resorption. And so far, it has been known that corticotomy and injection of substances like prostaglandins and osteocalcin can accelerate the orthodontic tooth movement. However, corticotomy is an invasive procedure, while injection of substances into alveolar socket may involve in local pain and discomfort. So that's why I generally arrived at the low-level laser therapy, which is a non-invasive technique and has widely applications in medicine and modern dentistry. And it's known that LOT can accelerate the cellular turnover, which may speed the rate of dental movement. And to the best of our knowledge, there were no randomized clinical trials evaluated the efficacy of LOT on orthodontic treatment time. So this pilot study is aimed to assess if low-level laser therapy enhances the efficiency of orthodontic dental alignment. Alright, so let's move on to material methods. Firstly, we selected 97 patients who want to receive orthodontic treatment at section of Orthodontic Milano Bicocca University, and 3 of them were refused to participate, while the other patients were enrolled based on the following criteria. For example, age between 13 to 30 years, angle class 1 molar occlusion, lower 6 to 6 mile crowding measure on dental cast, and no treatment plan including instructions. After that, they were allocated into 2 groups, controlled and tested, and that was when each of our subjects was assigned a study number which was concealed and to the date of bonding fixed appliance. And yes, our study was ethically approved by Ethics Committee of Faculty Medicine at the Milano Bicocca University and performed in the observance of Declaration of Helsinki. And then we did a follow-up and analysis, which will be discussed later on. And in terms of intervention, our participants were treated with 0.022-inch slot-empowered self-ligating appliances and low-profile tubes with MBT prescription. And both groups will receive the same arch wire sequence, which is 0.014-inch thermal nickel titanium arch wire. The arch wire sequence progressed if only the full bracket engagement was easily feasible, that is without forcing the rectangular wires throughout the bracket system. And the control visits were scheduled at the intervals of 4 weeks to check out the clinical progress and adjust the appliance if necessary. And on the same appointment, LOT was administered to the tested group using diode laser emitting infrared radiation at 980 nanometers, and the beam spot at a size of 1 centimeter square, and position the tip along the mandibular dental arch. And specifically, the four dental segments were administered for 8 seconds. These include canine first premolar on each side, central lateral incisor on each side, and 2 dental segments were administered for 9 seconds, including first molar and second premolar on each side. So that would be 50 seconds in total, and we repeated this procedure 3 times at intervals of 2 minutes. And the total energy density for the entire mandibular dental arch, corresponding to an exposure time of 150 seconds, was 150 joules per centimeter squared. And to quantify the initial amount of crowding in the lower arch from 6 to 6, the Little's irregularity index were used, and we're using the same operator to perform the measurements on the initial dental cast by means of the digital caliper. And to assess the alignment treatment time of both groups, we recorded the date brackets bonding. We recorded the date of brackets bonding and defined as T1, and the date of complete resolution of crowding defined as T2. And so the T2 minus T1 is the alignment treatment time. After that, we ran the log rank test and found out that the average treatment time was significantly shorter in the tested groups. that is 211.8 days, and compared to the control group, that is 284.1 days. Consequently, tested group needs significantly less control visit compared to the control groups based on the menu test. And to be specific, that is 7 visits versus 9.5 visits. And if you look closer at these Kaplan-Meier curves, you see the separation between the two curves, which indicates that the dental treatment time significantly difference between two groups. Alright, so this LOT protocol used in this study, including one intraoral administration per month with a total energy density of 150 joules per centimeter square. This energy density also failed to accelerate the retraction of canine into prospective studies. However, the ideal dose is still a concern because it is not possible to precisely calculate the light exposure to the cells due to the different amount of energy density losing during penetration through facial structures. And within the limits of this pilot study, we can conclude that intraoral administration of LOT significantly increased the efficiency of orthodontic dental treatment during the dental alignment. And patients who underwent LOT during orthodontic treatment require less control visits compared to control groups. So this brings me to the end of my presentation. If there are any questions, I'll be pleased to answer them. Thank you.